Hey everyone, my name is Andy. I'm a registered dietitian in private practice who, among other things, helps people to use the power of nutrition to reverse fatty liver disease. And so I have a large number of private clients who are trying to reverse fatty liver disease and monitor their progress on that journey. And one of the best ways to do that is to get a special scan known as a Fibroscan. Now, depending on where you are in the world, you may or may not have ready access to it. What a Fibroscan measures is two things: liver fat levels and then liver stiffness levels, which is a marker of fibrosis. So liver fat and liver fibrosis, two of the most important, if not the most important markers of liver health. So the question becomes, how often should somebody get a fibro scan if they have a choice to get it, let's say, as often as they want? And I would say it depends on a few factors. First of all, it depends on which marker you're concerned about. If you're looking at changes in liver fat or steatosis, the CAP score, minimum 3 months of your absolute best effort if you want to see a meaningful change. Now, if you're less concerned or you're making changes at a slower pace, you probably want to give it at least 6 months before retesting. You could certainly go longer. It really just depends on the urgency and how badly you want to see the influence of your changes, right? So 3 to 6 months and potentially longer for steatosis, for the CAP score. For the fibrosis score, for the liver stiffness score, when we look at like the human studies, you're looking at closer to 6 months of your best nutrition and lifestyle effort to see a meaningful change in that score. So if you're primarily concerned with fibrosis, I would say 6 months of your best effort. But again, if you are making changes slowly, there's less urgency to see a difference in the score. You could easily justify going 9 or 12 months. So if you're making changes pretty rapidly and you care about both liver fat and liver fibrosis, I think you can justify getting one 6 months after your first one, just to calm you down and to let you see, okay, hey, my changes are making a positive influence. But if you're less concerned and you're making changes more slowly, I think you can justify waiting 9 months to 12 months between Fibroscan tests. And again, it depends all on you, how accessible the machine is to you, how quickly and significantly you're making changes, and how much you care to see those changes. And in the absence of a Fibroscan, you can also get blood work, because the reality is, if liver enzymes go down, if triglycerides go down, if blood sugar goes down, if HDL, good cholesterol, goes up, if inflammatory markers go down, pretty much those are all signs that your liver is getting better. And you can absolutely use that blood work as a sign that probably, even if you don't get a Fibroscan, if you do get that blood work and that blood work is improving, it essentially does mean with reasonable confidence that your Fibroscan is probably improving too. Hope this video helped. Comment liver below if you want to work with me to reverse fatty liver disease.